Well, let's now get you the latest on the country's COVID situation. And India has reported 10,158 cases in the last 24 hours. Those are new cases reported. Active cases currently stand at 44,998. And now what we have learned from government sources is that COVID cases in the country will rise for the next 10 to 12 days and then subside. Government sources asserting that there's no need to worry over the latest uptick in infections across the country, that the infection is now in the endemic stage, is what the Health Ministry sources have said, even as infections clocked a fresh high in many months. In an endemic stage, an infection is restricted to a particular region. Well, to talk more about this, we're now joined by Dr. Rajesh Parekh, Director Medical Research, Jaslok Hospital, Mumbai, and Dr. Rachna Kucheria, founder, Doc Genie Telemedicine, epidemiologist. Thank you so much both for joining us. And Dr. Parekh, first to you, what would you say on these rising cases and, government, however, saying nothing to worry about, it will rise over the next 10 to 12 days and then start declining?
Good morning, Gargi. This rise in cases has been expected for quite some time. While the greatest rise has been in our country, it's already present. This subvariant of Omicron is already present in 22 countries. And in the United States also, we are seeing an exponential increase with about 26 states. That's half the states of the US in which we are seeing an increase. So that there is an increase and that it was to be expected is not astonishing. Yet we are fortunate thus far in that while this is a highly infective subvariant, in fact, the most infective subvariant of Omicron, it is not lethal. Cases are not severe. That many patients are not landing up in hospitals or in ICUs. But there are two things, Gargi, that we should not forget. We should not be lulled into a false sense of security, because we should always remember that for the past 3 years, we've always been 1 or 2 steps behind the virus. The virus has always been ahead of us. And now it is increasingly becoming like a game of chess with an accomplished player, that being the virus, where we have to anticipate what could be the possible things that might happen and take adequate preparations for them. So I think it's appropriate to say that we shouldn't be worried, but certainly we should be very concerned.
Right. Dr. Kucheria, the government saying that it's now, the health ministry saying that the infection is now endemic and, so far we're not seeing too much hospitalization. So that is a relief.
I agree. The hospitalization is quite low and the infection for most cases is pretty mild. But I also do agree that, systemic preparedness needs to be there. To piggyback on what Dr. Parekh said, we need to be prepared. We need to be able to measure how prepared we are. We need surveillance so that as best as we can, we do remain one step ahead or at least in sync with the virus. We don't have to react. We can respond in a prepared manner. So currently the infections are mild. Many people are not testing and there's no need to panic. I do agree with that philosophy as well because it's endemic. But sensible precautions, like if you're going to be around vulnerable, elderly, immune compromised people, then stay away or wear a mask if you absolutely have to. So I think just common sense, if you had any kind of upper respiratory infection at this point, not panicking, but the system needs to be prepared. The system needs to be monitoring and measuring. I think those elements we need to take care of.
Right, Dr. Parekh, even if the illness level is not the illness is not so severe, one does think about how till now everybody's had at least 1 or 2 cases or infections from the coronavirus, and one worries as to these subsequent infections, how they could affect the body in the long term.
Oh, absolutely, and of that we have to admit, Gargi, that we know very little. What are the long-term effects of COVID? These are just unraveling, and we are talking about the earlier variants, Delta, Omicron. Now, this particular variant is not just a mutation, mind you. It's a recombinant form, which is when 2 different variants enter a human body and inside they combine in a manner so as to become more infective. We have a recombinant variant. And another thing I think we should always be mindful of, that even a small percentage of a very large number does become absolutely a large number in itself. So the manner in which the exponential increase in these cases could also mean that over a period of time, you could have a substantial number of people landing up in hospitals, if not in ICU. So we have to be mindful of that, and hence we can never be adequately prepared. We have to reinstate all the measures that we've forgotten about. And finally, Gargi, fortunately, we've had about 3 years of experience. We know what to do. We don't have to reinvent the wheel. It's just that we have to put this into action. I've taken flights across the world where I am maybe just one, or maybe there's just another person on the plane who's wearing a mask along with me. I have not given up on my COVID appropriate behavior because I think, as most of us will acknowledge, the pandemic is far from over.
Right. And Dr. Kochariya, we do know that the government has commissioned a study that is looking into possible links between COVID infections and heart attacks in people. And so these are the kind of things that do, cause some amount of worry, even if the illness remains mild.
Agree. And the pages of long COVID, or what some of the long-term effects could be, those are under study world over. NIH has put a lot of money into it, and our government as well. So we will be learning as going forward. But I'd like to leave viewers with a couple of practical tips. If you have had COVID, the second time, first time, third time, then don't go back. At least this much we do know, to exercising, working out right away. Wait at least 4 to 6 weeks. Really slowly start with gentle walks, things like that you can look after yourselves. So I generally give the advice, slow down in all aspects of your life, act like a very, very senior citizen, elderly, for the next 4 to 6 weeks after infection. These are things that people can do themselves. So don't rush into, heading to the gym or working out or try to shake off, the excess lethargy or anything. Don't do that. Just sensible, good home eating, hydrating, resting, and knowing that, we don't know everything about the virus. It had the whole world on its knees for 3 years. So respect it and give your body the time to heal. Don't be in a hurry. Sometimes coughs are lingering. Sometimes the fever is lingering. We are also all learning. Listen to good advice and, be sensible yourselves and respect the virus and your bodies.
All right, Dr. Parekh, Dr. Kochariya, thank you so much for speaking to us here at NDTV.
Thank you for having us.